Hey, Tim.
Hey Bob, I was about to send you guys a message say with the lyrics to All By Myself. Don't want to be all by myself anymore.
Oh, you would have been fabulous too.
Yeah.
So anyway, so the link, it took me to I had to register, but by giving my first last name and
Hmm.
uh that was
Uh,
weird. But then it took me right in because the
yeah.
meeting had already started.
Okay.
I don't know. It'll
So,
work for
because
people.
there's another one. What you click your well wave, your well
Yeah,
wave now.
WellWaveNOW.live.
Hmm.
Yeah. But it
Okay.
took me in. So I can
Okay.
change that every time to something else. So
Okay.
I can redirect it.
All
And
right.
meeting is in focus mode. Only host and co-host can see your video. Okay, that means that so
Yes,
that
I'll
means
make
that
you.
we're going to be only the ones on the screen, and
Yeah,
Brett.
we should be. Well, it'll be like it was before. There should be a way where I should have to spotlight you, but I'm not seeing where I've got to spotlight you.
Are we
Uh,
co-hosts?
yeah, I just made you a co-host.
Okay, this guy Maury is coming on. He was in the Mike. He was one of the. There were two people in Mike Hayes's
Yeah.
speed networking. Here's Maury. Yeah, you're on me now. You spotlighted me. I guess you have to spotlight.
I guess that's
Yeah,
which is the third one. Yes.
but this isn't bad either. Hey, Maury.
Yeah.
Hey, Maury.
Hey
I didn't.
guys.
Can we start texting each other instead? Because I didn't even
Yeah,
save the. I forgot to
yeah.
save the chat. What's your? Go ahead and give me your
Can
cell
you,
phone number.
yeah, can you text to Canada? Okay. It doesn't cost you anything.
I think so. Yeah, go ahead.
Okay. So it's one four
Yeah,
one six
416
eight seven six
876
7939.
7939. Okay.
Yeah.
What's the formal name of your technique?
The Maury method
Is it really?
currently. Yeah. It's not my choice. That was
Okay.
not my choice. I thought that was egotistical as all hell, to be honest with you.
It's not a problem. I mean, it's okay. Really, seriously.
Well, some of the new business people I'm dealing with want to change it, and I'm totally fine with that. I have no ego when it comes to this at all. I just want the work to help. That's all.
Right. Okay, I'm gonna go ahead and send this to you.
And then I'll put your name in because it's just going to show me your phone number.
Yeah, I'm putting my name in my text. I'm sending you everything.
Cool.
It'll have my information, so you won't have to really do anything.
Wonderful.
Breck, welcome. Good to see you.
Thanks. Good to see you.
Hi, Breck.
Long time.
Yep. I always know it's 80 degrees in Phoenix when you don't have your jacket on. There that when it's only 65 or 70 in Phoenix, the jacket goes on there.
Yeah, I haven't even been outside yet today. I have no idea what. Oh, it's 93.
Yeah.
Wow, that's hot.
Yep.
We'll give it to our guest here. We'll give it another minute or two. There's 4:01, but out of respect for you, we'll give it another minute or so, and then we'll go ahead and get started.
Yeah.
And it's well, although I've got to call out an uh, old classmate of mine, actually upperclassman of mine who's joined us. I'm glad to have with us here, and that's Jay Bryant. We used to play sax together. I think I was second chair behind Jay. It took him leaving for me to get the first chair.
Good to see you.
Yeah, good to see you. Did I ever? I'm trying to remember, Jay. Did I ever challenge? I don't think. I think I might have been too scared to challenge Jay. You know, I always had those challenges. Did I ever challenge you, Jay? I don't remember that or not. If I did or not.
You challenged me frequently.
I guess it's the frequent beating that I kept out of that I made me forget and get out of my mind there. But yeah, but like I said, it took him leaving for me to get that first chair.
And after 40 years, I picked up the sax again. I've been playing in a local band.
Yeah, yeah, remember you mentioning that. That's good. I'm thinking. I consider to think about picking it up again. I haven't yet. We'll get started. My son, who is actually has a perfect pitch, in other things called something called synesthesia, where he actually kind of sees where he hears music, he also sees sounds. Yeah, he taught himself the sax and was actually very good on it before he moved on to other things.
It's interesting. We both have ended up in the healthcare space
Yeah,
after all these years.
absolutely. It's good. All right, so go ahead, Breck.
Speaking
Were you
of
say something?
singing, Tim, I'm a tenor, 10 or 11 notes off key usually. So.
Yeah.
Well, that'll work. We're going to go ahead and get started here. So welcome again to our guest, and thanks for joining us here for this session of the WellWaveNOW community with our panel here that we lead the discussion here. So a little bit of logistics here as we get started. One, we're going to run for about 27 to 30 minutes. If you're okay, we might go over 3 minutes because we're starting here a little bit late. But if you could go ahead and if you have questions along the way, if you'll put that into the chat, and we'll try to work those in the latter part of the session. And then we often stick around in case anybody does have questions or addressed, that we'll talk to them then as well for a few minutes. So with that, so let me tell you a little bit about the WellWaveNOW group and why our panel here that we lead and why we do so. Now, we see our purpose is really helping to enable people through information, wisdom, resources, advice, and services to really be able to take charge of their wellness and achieve what they specifically specifically for themselves. So their own individual situations, what they can achieve in terms of wellness, and to help them be able to accomplish that. We don't look to and certainly we look to ourselves as the complementers and supplementers to the conventional health providers. We certainly do not look to replace them. We like to collaborate with them. And we also like to enable our community to be better collaboration with their healthcare professionals. So the three of us on the screen, one remote here that we haven't, Paul, he doesn't like the spotlight, but we'll introduce him first. And that's Mike Hayes, who also is a very valuable part of our group. And Mike is a promoter for us. It does no good to have a message if you can't get it out. And he's got a couple of Peabody Awards for journalism and is known as an interviewer to the stars. Then we've got Breck Rice with us, and Breck is a health and wellness influencer, and along with that is a proponent and enabler of community pharmacies and helping them thrive and survive, as well as now getting very much into a focus on community wellness as the chairman of Bryn Health, and making sure that our communities and that that whether it's underserved or remote or rural communities are get better wellness and delivery of that. Breck has taken a very lead on that as chairman of Bryn Health, making that work. Then Dr. Bob Levine is my cohort in crime, who I always like to just go head to head with Bob in a little chess match because he's so good at it. And it's like Mr. Jay used to beat me all the time at the sax, and I had to be second chair. You know, I like to just step up and go against our brain researcher and leading expert in pain and drug-free pain management out there, and just go back and forth with Bob a little bit on that. I'm Tim Daniels, and I am a wellness plan manager, and I consider myself a trailblazer in that area. It's much too briefly, you have financial managers who help you bring all together to manage the financial part of your life. The wellness plan management, I think, is a much needed and area to go into to do the same thing in your wellness world. And I bring to bear in that a background as running a home care agency, high-tech wellness, being good project management was needed to that. Bring that all to bear to help people understand what they can achieve in their wellness, help them achieve, plan, and execute that wellness in that. So that's my role. And today we're starting a series that we call, Take Charge. And I want to get this exactly right because we took some time coming up with this one. And it's called Take Charge, the what, why, and how to lead in your health and wellness journey. And here we're really going to do that, delving into the process of empowering you to take proactive control over your health and wellness. But over the course of that series, we'll get into how do you do self-assessment, how do you collaborate with your healthcare providers, how do you take leadership in providing with your healthcare providers, among other things. But first, to get that started, we think it's important that we really have a little discussion here on what is wellness versus health, and what are both aspects of that. So Breck or Bob, which well, I'm gonna hit Breck first on this one. So Breck, what's your view on that? And again, to our audience, if you ever come to us and need help on a specific item, and the three of us collaborate, we're going to agree on how to collaborate and help you move forward. We'll make that work. Much like a panel of experts in the healthcare world, we'll get together, discuss the case. But in lieu of that, we don't look to always completely agree with each other. We think part of our dialogue and different opinions are as help on that. So Breck, go ahead. I'd love to have your opinion on that, health versus wellness.
Yeah, I appreciate that, Tim. So, and I'm glad that we're talking about this and have this same discussion for the next couple of weeks, because I really am a firm believer that we had created this whole society of, I call it a microwave society, where we want instant gratification. So if we have an ache or pain, we want to just be able to pop a pill and take care of that. If we have something going on that's just an inconvenience, we want to just have a pill that we can take, and not realizing how detrimental that might be and how ineffective it can be for even over 50% of the patient population that's on that particular prescribed medication. That's why I launched my whole campaign around scary drug facts. Know what you're actually taking in your body and make sure your body can actually metabolize it. Because obviously, if the benefit is there for you, great. But if the side effects outweigh the benefit, then you really need to do something different. So,
Hey, Breck, when you say talk about how the body metabolizes it, can you just break that down to lay terms? Like, what does that really mean?
yeah. So, the whole, you're the professor on this topic, so you could tell us chemically
All
how
right, okay.
it happens.
Well, yeah, I mean, I can say I know all about this, but what I wanted to say for people who may not have followed that is that when you take a drug, the way your body's genome DNA works, there's drug metabolizing enzymes. These are enzymes that transform drugs, break them down. Sometimes the drug comes into the body, it needs to be converted to an active compound. And that's the case with a lot of drugs, actually. So if you take a drug in and you don't have the ability because of your genetics to transform that drug into the active compound, then you're just taking the drug. It's kind of a waste of time. And you can still get the side effects without getting the beneficial effects. So, and Breck's got a real great way to, and some of the people we work with to test that. So that's what I wanted to say about that. So
Yeah,
Right.
yeah, no, and even the best intended medication still only has, maybe a 30 to 50% efficacy, meaning that literally 50 to 70% of the patients taking that medication don't get the intended benefit. So it's really important to understand your genetic makeup and what you can absorb and what doesn't absorb for you. Or maybe it's the right medication, it's just the wrong dosing because your metabolism is so much faster than everybody that was studied.
Yeah,
right, or slower. Yeah.
Yeah,
Go ahead, Tim.
and that's another point, I guess, using that potentially as a point for our conversation here. What if and why someone needs to take leadership on their health. We still got to come back a little more for our contrasting, but I didn't want to let that pass. What do you think the adoption rate by, certainly, when I go to my primary care and she's provided some thoughts on it, as well as I work with my clients and they go forward. I haven't seen any of them yet ask for the genetic testing. So what are you seeing as a prevalence out there of asking for that genetic testing on it? What you're seeing, Brett?
Yeah, so not all of the carriers cover it. And so it's
Mhm.
an out-of-pocket expense for most patients. Now, Medicare will cover it for, 65 and older population, as long as they're on multiple medications, so 3 to 5 medications or more. And one of those medications needs to be either a psych drug or a heart medication. Then Medicare will actually cover it. So
aside that, so on a private pay basis, and I'm a private pay kind of guy. My home care agency was private pay, and I kind of liked it. And so there are, yes, we'd like to have it in reach of everybody out there. But in that light, what's the expense of the? So I know you offer for that pharmacogenetic testing. What do you see as the expense if it's not covered by providers?
yeah, luckily it's coming down, right? So it used to be a $1,000 test to get a full comprehensive. And now they're starting to come down in price. You can get them like $550 for a comprehensive. And if you're just specifically checking one medication, so maybe you've been prescribed a new drug, and you want to just have that one single panel tested, then it's only maybe $150. We hope to get those tests down to about, $100 for the comprehensive that covers all medications. So they're just not quite there yet.
Yeah, great.
That'd be
And that's
great.
yeah, part of what we like to do here is, sir, we all have products offering services out there, but we also like to have provide hints and thoughts and things that people can take away and research and do on their own without us. And I think that's one of the key areas. There are certainly, I've certainly had clients where we're looking for experimental drugs to treat neuropathy and other things. We're going to spend a lot of money on it. Certainly in their case, it's worth spending that $150 to see what they think is going to be effective for them. But so appreciate that, Break. To bring it back up.
Yeah, so back to your original question.
There you go.
There are some subtle differences. It's some important differences between wellness and health. When you look at health, that usually means the absence of disease, right? If someone's healthy, they don't have disease or illness or sickness, and they're, in a state of physical and mental well-being. But where the crossover in wellness is taking more of a holistic approach and achieving a very full balance. So taking measures for prevention of what may come down the road. And so, yeah, today you might be healthy, and your lab work can come back and you're in normal range, but what does normal mean from one patient to the next patient? And so wellness is taking more of a looking forward approach and saying, okay, I'm going to do these things here to make sure I stay healthy. And so it's taking responsibility for that whole pathway to having a balanced, fulfilled life.
All right, Bob, what's your view?
I think what Breck said is really great, and I tend to divide them just a hair differently. I look at health as it's almost like a snapshot, like how's your health now, and it involves the physiological aspects of a person, the imaging of a person, all the psychological assessment, whatever it happens to be. It's all these health parameters, and so I look at health. For me, health is how's your health now? What are your diagnoses? And I look at wellness as all of it. To me, health is a component of the wellness umbrella, because there's relationships, there's communication, there's finance, there's health in general, there's a myriad of things. So there's what you do for work, what's your satisfaction level with your career, right? All these different things that are part of wellness. So to me, wellness is like the umbrella, and health is a big part of it, and it involves but like I said, the measures, the diagnoses, things like that. So I'll leave it there, Jim.
All right. And for once, I kind of agree with both of you a little bit here.
Oh my God, you're kidding. It's so good. I don't know.
I'm sure glad this is being
just
recorded right now.
Yeah. So I see, like with and Mike, I see you raised your hand but if you got, I'll bring you in a second to a comment. Let me go here. So what you articulated, Breck, I think you also brought into the part of potential. And that's also I see wellness feed. I think it is the umbrella you talked to, Bob. And I think part of that umbrella is that wellness has got the potential to feed into health. It's the looking at the potential of what could be. For example, I had one of my favorite groups to work with is the elderly still. And I had a person that was working with her recently, and she's I'm taking what she said at fact, and there was no shading of what the doctor said. She's sitting there and she's laying in bed, and I can see she's got no muscle on her. She can barely stand up. She's missing some teeth in there. And she's telling me that her doctor says, aside from her back, she's healthy. Okay, well, that's the snapshot. So I'm indicating wrong, but that's certainly not in my mind what wellness is about. Meaning, even because I know even at 80, with the right diet, with the right exercise, you can build muscle on that. certainly with their, with their teeth. Those should have been taken care of in order for her to take in the right nutrients, et cetera, et cetera. So there's still that, but she might have not had any specific disease, but she still had to meet a potential to meet state, to meet a different state. So I also see health as sort of relative on the scale. I've got my old ripped up knees from my wrestling days, and so I overall healthy I see, but it causes me problems. But I think I can improve the potential of those and work with them for comfort. Bob, you want to state something?
Well, I just wanted to say that I wanted to connect our next topic, which is on, taking responsibility involves self-assessment. And what Breck was talking about, what we were talking about earlier with the DNA testing, that's like self-assessment. How do people take responsibility for, for their journey, their health and wellness journey? Tim, I'm going to throw that one at you.
And I will. That's a role. But as I take that self-assessment as part of the topic we want to talk about is say, even if you put it right on the health, the health column alone, not the health and wellness column, you still need to take leadership on that. And part of that is that self-assessment. I'll even state, part of what we were talking about in another forum, Bob, for example, I'll keep it, in this, where I look to focus on stress. And I'm working on this wonderful stress mastery course that I'm sure Breck and Bob will just love to take themselves and take a part in that too, but we'll do that. But part of that is how do you stress is something that should be shrugged off because of the physical impact it can have on blood pressure, heart disease, other things of that nature. So part of that is a self-assessment. I look and I track myself and encourage my clients and work with them and track among, say, subjective things that looks about, how are you sleeping? Are you irritable? What's your moods? I also look for, track, say, 3 physical measures. What's my breath rate? What's my blood pressure? Do I take that in the morning? What's my heart rate? And so I know if those start differing and its reaction to stress, that there's some action I ought to take. And if those things come off and it's not a reaction to stress, then I know maybe I ought to go see my healthcare professional because there's something else going on in that. So, and same with my clients. So I think that portion, Bob, of being able to, on all areas of health, whether it's some of the world you work in, like you would talk to, is pain. And whether it's pain, whether it's stress, whether it's joint, digestion, if you should have some assessment to be able to provide that leadership to get in one element to get proactive. There are many other reasons to take leadership, but just that proactiveness, I think, is one reason, Bob.
Yeah. How about you, Breck?
I want to make sure we get Mike's question covered.
Okay, thank you, Breck. The reason I'm being ignored, no, I'm only kidding, is I'm just the broadcaster in the group, okay? I'm the observer, I'm the communicator for our audience. And so I will communicate about kind of our organization meeting, and we talk about all this stuff. And one of the things that we talked about, and as you can hear, all of these gentlemen are talking about this. And it's the silver bullet. We all kind of decided, everybody always wants the silver bullet. And we all kind of collectively decided really the silver bullet is your own personal responsibility. It's your body and not putting your health provider up on a pedestal, but really taking responsibility. And that's one of the things that we really talked about. That is the ultimate silver bullet. And that's what everybody's talking about. So I just wanted to share that with the audience. So thanks for that, Breck.
Thanks, Mike. All right.
Absolutely.
So,
And, yeah, in essence, just recap what we've talked about here. Health is really the prerequisite to wellness, right? So it's one thing to just be free of disease, but wellness then goes beyond that, and that's where you're making conscious, decisions to exercise and to have proper diet and to do things that you're looking at for longevity and to have the most full life.
Right. Yeah. It's almost, well, I always look at the expression of dis-ease or symptoms of disease as a threshold phenomenon. And if you're below threshold, then you're not expressing the disease symptoms, right? And if you rise above threshold, you start to express disease symptoms. So I look at, wellness as the ability to stay below threshold. How do you keep yourself below that threshold? And so that you don't cross it. migraine headaches is a great example. There's all kinds of triggers of migraine. A lot of times people are below threshold, but when they hit that trigger and they go above, they get into migraine. And the question is, how do you bring them back below that? So, but I also wanted to mention about responsibility. With responsibility comes like digging in, doing the research, checking out things, getting multiple opinions from people. People can join, forums on the condition that they're investigating, to hear from other people, other doctors, and second opinions, third opinions, whatever it takes to gather all the information together. And then we need to use our powers of interpretation to, I watched my mom do that. She had no medical background at all. She's an English teacher and a history teacher, and she would gather all the information and she'd make decisions based on that. And she did a pretty good job. I mean, I hear now.
And let me ask you, because I think you always rush to add that value, Bob, and you're kind of getting into how to do it and how to take that lead, but we still want to spend a little more time on the why, and you had some good insights on that in another form. Is why just in that health area? For example, you mentioned take the drive to get second opinions is one, but to kind of prompt you. But so why in that health area alone do you think is important for the individual to get that education and knowledge that your mother had to be able to take the lead in their health?
Well, I think it's important to get educated. That's part of self-assessment. The education allows you to self-assess. Like when I teach people about, what kind of ways of being they're expressing, what kind of results they're producing in their lives. If they're not getting the results they want in their lives, that's self-assessment. I'm not getting the results I want. Why? Why am I not getting the results? Well, the actions I'm taking aren't producing the results that I want. And what's having us take these actions? Well, I always related back, and Tim, you and I discussed this a lot. The way of being that's expressed, which drives the actions, which produces the results. Whatever we, or some, as you said, Tim, well, what about the thoughts? The thoughts are also driving actions. And so I say, whatever is driving the actions are producing the results. And if somebody's got results of ill health and relationships that don't work and all kinds of other problems in life, they need to assess that. That's part of the self-assessment. So there's all kinds of ways to self-assess. Go to your doctor and get your blood work done. As Breck talks about, getting your genetic makeup done, assessing yourself, your psyche, your mind. Nobody's better at assessing their themselves than us. We can assess ourselves, especially when life isn't going the way we want. Then we can talk to people about, well, why isn't it going the way we want? Maybe we want a health coach, we want a life coach, right? So, but that's just something I wanted to say about there's many ways to self-assess. And Tim, you got some ideas about how to self-assess as well, right?
Well, there's a number of ways on self-assessment. I just want to add, first a little bit more on why I think it's important for a person in that health column to really take that lead. And it gets a little bit back to Mike. And let me reiterate my opening comment. Here more to complement and supplement healthcare professionals, certainly not replace them, and certainly collaborate with them. But I've also come from my home care, working in that home care world and helping many of my patients with their healthcare and collaborating with their healthcare providers for over 8 years. Really came to that view that that Mike has achieved. They're knowledgeable. You got to take their lead, but you can't put that healthcare provider up on a pedestal because they're humans as well, and many of them are seeing hundreds, if not thousands, of patients, and they can take 50. As you know, Brett, from looking at the insurance reimbursement and helping that with veterinarians, sometimes they can take 15 to 20 minutes with you. So part of that is making sure that you do, and this ties back to your self-assessment, that you know what your body is like, what your body is experiencing, that you can articulate that quickly and effectively to them to be able to help them make that diagnosis. So that's one portion of it. Number two, we've got so many specialists going. I have a lot of clients that go run here to see this specialist, that specialist. Sometimes if you've got a great network, out here we've got Yale New Haven, where I'm at in Connecticut, you got Yale New Haven, where I went to college, you got the Stanford Medical System. Sometimes they've got to build in where the specialists will get together and talk about the patients, but that's not always the case if you're not in one of those systems. So you've got to kind of be your self-integrator. If you go to see the ear, nose, and throat person, you've got to have a certain knowledge, and you may feed that back to your primary care for a discussion. So sometimes you've got to be you got to have the knowledge to do it. You've got to have the knowledge. It's important to have the knowledge of your body and what you're feeling and your systems and symptoms and how to articulate that to help the provider. And sometimes you've got to be a self-integrator to get the right care. And you've got to know exactly what they're looking at. For I had a person I was working with recently who declined a PET scan because they knew what they were talking about. Because they said, look, if you find what you're looking for in this particular case, there's nothing that you would do about it at this point in time, right? And she asked, well, what's the route of radiation I get with this? And the doctor said, it hadn't said before, but said, you get a substantial amount of radiation with this PET. She said, what's the potential effects of that? They went through that. She said, there's no reason for me to have this right now because I'm not manifesting the systems, any systems you would do anything about. So I want to open it back up to you two. But that's for me, for a number of those reasons, to be a self-integrator, to help select your care, to be able to provide your healthcare provider to provide information, even in that health column. That's why it's important some of the reasons it's important to be able to provide leadership to it. Go ahead, Bob. You're on mute, Bob.
Yeah, what I wanted to add was, what I want to add is that I think communication between us or the patient and the doctor or whoever it is, the healthcare professional, is really vital. And I think a lot of patients are intimidated by their doctors. And so when you take charge, you no longer are intimidated.
Right.
When you're being confident that you can communicate and you can ask questions, people want to know that there's no silly or stupid or question that it should be asked to the healthcare professionals. And so communication is vital, and speaking up for yourself. That's what taking charge is all about. That's what taking responsibility is all about.
Absolutely. Yeah, Bob, you're Mr. Communicator. I'm surprised you didn't say that before, and I'm glad you brought it up. But in that light, I've often, my doctors have been asking me, what do I, and I preface by saying, most doctors that are good, like that educated patient, love to work with them, love to interact with them. In that light, my doctor's been telling me, hey, I like what you're doing. You're very informed. You're a researcher. What do you do? I tell them I spend 3 days a week with Dr. Bob and Breck. And so that puts me in a position to work with you guys. But they appreciate it.
That's good. That's good. I'm surprised you didn't say I have to suffer 3 days a week.
Yeah.
Dr. Bob and Breck.
So I've spammed the chat a little bit there with a link. This is a free health risk assessment. We've talked a lot about taking responsibility and having some way of checking where you're at. So if you'll click on that, it's totally free. If you can answer the questions appropriately, it literally will add 8 to 10 years in your life. So add a whole decade to your lifespan. If you can't answer all the questions correctly, then we probably need to have a discussion. This is in a precursor to opening up all these wellness clinics that will be launching later this year. We already have 100 locations that are ready to get set up. Until those are up and running and can help you with this health assessment, we'll just refer it back to your primary care provider if there are challenges that you need to discuss.
And I also put my contact information in the chat. And so if anybody wants to get a hold of me, that's the way to do it. And go ahead, Tim.
Yeah, so I was just gonna say, part of what, Breck, you look about the wonderful technology you've got in the pharmacogenetic testing, and one of the things you bring about in that also when you do that quiz on that, and to me, that's another reason why I want to drive home that you need to take the leadership with your health providers. There's a technology that all three of us use, for example, pulse electromagnetic field therapy, that has 20,000 studies around it, has gold standard studies on PubMed.gov and out on Google Scholar. But I still find less than 5% is used everywhere from oncologists to podiatrists and things of that nature for various reasons, as both a primary and as a complementary health, but a lot of healthcare professionals don't know about it. So being able to bring that forth, discussion could provide treatment. So that your pharmacogenetic testing, the PEMF, some of the things Bob talks about in the visualization, all those are things that are backed by science, proven, that you bring forward to your healthcare provider and work with them to take that leadership and achieve what you need to achieve on that. So with that, I think, if let's see if we've got any questions. I'm going to put my contact information in the chat. But Bob and Breck, if you'll take a lead if there's any questions, well, I do appreciate it.
There's let's see, I think Bernard put in there, said, I'm looking forward to challenging that silver bullet self-diagnosis mentality. So Bernard, you want to unmute yourself if you are still there and you wanted to say something about that? That'd be pretty cool. Otherwise, I'm going to interpret what you said there and see if Brett can answer it.
First of all, how you doing? Excellent
Great, Bernard.
discussion that you all have. And I don't even truthfully know how to put it, but I guess I'll start off by saying, what are you all's thoughts when it comes to the dynamic of fear, or I got something that I talk about all the time, life infrastructure, where a person has to be a certain way in order to move forward and accomplish things. But most people out here, their life infrastructure isn't secure. So what are you all's feelings when it comes to the majority of people out here as compared to that perfect person who's able to self-diagnose, or not even necessarily perfect, but a person who is able to even get to the point of proactivity with themselves before they speak to someone like you all, which goes to my second question. What do you all consider you all selves as, reactive or proactive helpers, which goes to kind of my thought process around how do you all incorporate the mind and the mindset, understanding the particular people who you most likely are going to be dealing with as compared to the perfect person. Because you all mentioned something earlier revolving around, if I'm not mistaken, you all mentioned something you all use as far as self-diagnosing you all selves and being kind of proactive in that activity first and foremost. I can't remember the terms you all were using, but just kind of how do you all consider yourselves? Do you all first put yourselves in the mindset of people who actually truly need this, which is low-income individuals, people with not necessarily the highest IQ,
Right.
or people who, when it comes to fear, I want to give you all an analogy. You all talk about first having information first. Well, as a basketball player, I can understand the sport, but when you sub me in a game with a bunch of NBA players, all of a sudden fear takes over and I close my mouth. I don't perform the same. Well, that's the same in the medical field as well when it comes to whether I have the information or not, whether I have the personal information or not. To when I walk in that doctor's office, there's still a level of fear where I'm not explaining myself correctly, et cetera, et cetera. So how do you all attack those individuals, which in my opinion are the majority?
Yeah, you struck a nerve with me, Bernard, because that's exactly why we're setting up the wellness centers the way that they're being set up, is that patients, number one, don't feel comfortable asking some of those basic questions to their healthcare provider because, number one, they may only see him once a year. And let's be honest, you only get to see that doc for 5 minutes, right? He's in and out. But the most trusted health advisor for the last 10 years plus has been your pharmacist, because you'll see him, 12 times a year, possibly, once a month for whatever prescription you may need.
And they'll talk to you for a few minutes.
Right.
They'll talk to you for a few minutes, right?
Yeah, and they'll actually take some time with you. But yeah, so to put these wellness programs inside of that most trusted healthcare provider, the pharmacy, the community pharmacy who actually has time for you, you may not get the same attention at a CVS or Walgreens, but your independently owned community pharmacy, they're going to take as much time to make sure that you get help. But then to have that coaching, just like you brought the example of basketball, you wouldn't feel, you'd feel nervous getting on the court at any time if you hadn't been properly coached. So to have those coaches there to support those individuals. The other thing too I'll mention about that is we've seen a lot of programs that have tried to come in similarly to this and have a community wellness program but they were all more of a concierge or a subscription model. And there again, it's going to leave out all of the people that don't have extra money to be spending on some concierge medicine program. So to be able to take Medicare, Medicaid, be credentialed with those payers to serve the entire community, not just those who can afford it.
Right. And to supplement that, I go back to my my home care days when I got involved, where I first came about understanding these resources. But that's what I try to help people understand is that regardless of their income, there are resources that are available to them in getting. Some of them are overtasked, but some are very good. There's the state has a Department of Social Services that helps with these various things. Number two, many towns, depending upon their size, they have a town nurse who will work to come see people, to work as an advocate. There's a whole profession called patient advocates. And some of them work the real high-end private pay, but others of those work in nonprofits that are funded to work to help those people who don't have the education, who don't feel comfortable doing the research, to be able to become their advocates and within the healthcare system, as to just help them as to which doctors to go to if they're going to leave the hospital. And they need to go to rehab, helping to pick the right rehab and things of that nature, and working with them on that. So there are government related resources for those. There are patient advocates that are available for various levels. And sometimes, then you look to say, are there family members who can step in and are willing to step in and can help in that advocacy? There are more and more doctors and others are asking, is there someone you want to bring, understanding what you talked about, Bernard, in terms of the nervousness and the things of that nature. They're asking, is there someone you'd like to bring along with you?
And to kind of play the devil advocate to that, if I was to create two categories, proactive and reactive, all of what you're talking about is reactivity. How do you get these people to actually go to this clinic? This has been the issue the entire time when it comes to those type of communities, is the fear of leaving their community to go into another community. That's a whole nother conversation. So I just think more dedication has to be focused on forcing that proactivity, as compared to saying, once you come into this space, this is all I can offer. Well, what you've noticed is there's a large amount of activity in that space. But in the proactive space, Tim, you just mentioned it, very few proactive spaces. You have subscription-based things, et cetera, and it's extremely difficult. I'm sorry, Dr. Levine.
Oh, no, Bernard, I was just going to wait for you to be done. I wanted Tim and Breck to know that I wanted to jump in. Did you finish?
Yes, I'm done.
Well, I'm going to tell you, Bernard, your questions and comments are so insightful. And you're at the heart of one of the biggest issues in healthcare and in health and wellness in general. And I put in the chat, I put a link in there, thegreatdiscovery.com/drbob. You can get free programs there online. It's a new e-learning platform and called The Great Discovery. You can search for health and wellness programs. So you just gave me a great idea. I am going to put together a free program for how to communicate with health professionals, how patients can communicate effectively with health professionals. Like, I hope I can remember that title, because the thing is that you're exactly right. I mean, even somebody like me with a PhD in brain research, sometimes I used to go to the hospital and, like, especially with family members, and, I'd have to be the one to advocate for them. And I'm like, Jesus, do I have what it takes to advocate for my family member? How's the doctor going to receive what I have to say? All these thoughts going on in my head, and even in my head, right? And I've got a lot of training and knowledge. So you're absolutely right, Bernard. And this whole fear thing is a big deal, because most people are operating automatically out of fear for a lot of things, and especially for what, they feel something in their bodies. It's like, oh my gosh, what is that? That I'm feeling. Or I got to talk to the doctor. What if, and believe is, so I teach people about communication, because I taught communication training for many, many years with, I don't know, a couple thousand people.
And also, doctor, I think is one of the things that Tim mentioned earlier around stress. Now, what is fear connected to? stress. And oftentimes
absolutely.
stress stops you from doing specific things. You don't want to go in specific places because you don't want to learn more. I think all of these things are connected when it comes to that proactive approach in the medical field that many don't want to touch. It may be expensive for whatever reason. But I think if there's a space that hasn't been tapped into enough that can generate a lot of money, is figuring out that area, exactly what you're talking about, Doc.
Well, I didn't even know about generating money because we got to figure out how to get people the information they need, like you said. I mean, the education, I mean, how to get them to explore a little bit. Tim's creating a phenomenal stress as management course, as he calls it, but it's really about having stress not dominate your life. And he's going to be mounting that on the greatdiscovery.com platform. And he'll be sharing with you how to get that in our future, some of our future shows. But that's why I pointed that out, because there is free information out there. There's a lot of it, and people want to go get it and just educate themselves as best they can. And I heard you said about low IQ, but there's videos people can watch if they're not big readers. And there's, some of my writing is pretty simple, actually. I like to keep things simple. I think I have a simple mind, and if it's, one thing I know is that if it's not simple, it's not going to work. People are not going to gravitate to it, and they're not going to absorb it, and they're going to be pissed off because they spent their time trying to figure it out. So simple communication is really important, Bernard. So thank you for your comments.
Appreciate
Really.
that.
Thank
And then
you. Thank you, guys.
Before I let Mike, I have Mike comment here. I want to add to that. Part of the challenge become across the spectrum of stuff. I think Bernard mentioned and you touched upon, Bob, is how do you get people to take that action and make that movement? Because I'll reiterate, even in that challenge financially and educationally wise part of society needs it. I can point to from the past and my now current knowledge of a lot of programs that are out there that's offered at libraries, that's offered at senior centers, that's offered at town-based things such as daycare, where they'll go through and talk about, here's who can help you. Here's the programs we have. Here's what's out there. Here's how you can do that. Here's how you can help yourself. Here's how we can help you. But I will tell you the attendance. But to your point, Bob, yes, I think we still need to do the other. It's a great discovery, the videos, the work we do. All those ways have to be out there. But the biggest challenge is getting someone to come. How do you get them to come forward to that? It's almost like you got to do a mass mailer week after week to every household in America, letting them know what's out there. And then giving them and then somehow getting the incentive and the thought in their mind that they need to take them to those avenues.
And Tim, that's what I'm saying. What I'm saying is, as much dedication as it is to providing kind of reactive things such as medicine and prescriptions and the locations and brick and mortars and content and information, all of these things that if you have this or once you have this is what you do. As much money has been devoted to that, there has not been nowhere near as much money and thought and process devoted to the proactive side of how do you get people to actually devote themselves to doing this. And and if you were to devote that time and effort and experience, time to that, you'll see that the areas in which you get these people to do that are often not even thought of. They're not touched. They're not provided. Oftentimes it's revolving around somebody who is stressed or uncomfortable with themselves. So the ultimate answer is you have to come to them. That's absolutely, if you don't want to do that, then you're not really curing anything. You're only speaking to those people who are willing to come to you. And you have to separate those two to really see that. Right. Which when you do the math is a small percentage of people as compared to the people who actually really need that. The same with stress, the same with a lot of other things, right? Mental health, all these things are connected on that proactive side.
Let me comment to Bernard, if I may. Bernard, I'm hearing you. I wrote down notes. I'm a broadcaster. I've been a long time documentarian. I've interviewed everybody across the spectrum. I've interviewed women who killed their own children in Rikers Island. So I've I've interviewed people across every imaginable walk of life. I will take it as my personal responsibility in these meetings to represent the people that you are talking about as a broadcaster, to make sure that, you know, individuals are not being overlooked, you know, if they have a low IQ or, you know, whatever their economic level is. I will be the broadcaster that will make sure they are represented. As we are moving forward and developing this, your comments were great. I respect them. I really listen to them, and I want to represent you. Now, I also work with a Great Discovery. I put my contact information in the chat. If you are interested in developing a course on anything, please feel free to reach out to me. I will interview you, and I will show you what the Great Discovery can do for your courses, for Bob's courses, for anybody that wants to create courses. So
Right.
we hear you, and we do want to represent you. So thank you, Bernard.
Thank you, Mike Hayes. Thank you. I appreciate that.
Appreciate it.
Thank you.
And Mohiba's got her hand up.
Yep.
Thank you so much. I'm so interested in what has been said and what has been felt. And if I may participate with, when I go to see a doctor, I usually prepare my questions, write them down, because I know they are going to press me. I'm not going to be pressed, and I'm not going to be, and the word is intimidated by their body language, because they say yes, and the yes is be quick, be brief. And all of a sudden, I'm not afraid, I'm not frightened or anything, I'm just intimidated. And all of a sudden, of course, you know the result. I forget half the questions, and I say, I'm going to pay a lot of money to see the doctor. And then when I leave and I say, he or she has given me how much time? I come from academia. I would be walking out after 3 or 4 hours of work, and a student stops me, and I will stay there for half an hour, and they realize, oh my God, I don't have time for that, but it's too late. I would have given half an hour. These people, I say, what goes into their mind? They are giving health. They should be grateful for giving that time for people to feel better. And my second point is really to do with any work I can do, free of charge, charged, whatever, please involve me. I have become, after being a professor, university professor, I have become a life coach. I'm very interested in transformational relationship coaching, well-being coaching, health in the sense of well-being, wellness. That's what I'm interested in. So any program in which I can be involved, as I said, people can't pay free of charge. I have no problem at all with money. The pleasure of giving is my only incentive. And thank you.
Thank you for saying that.
Appreciate that.
Appreciate you participating. What university were you at?
Actually, I was at Tunis University because I'm Tunisian, originally Tunisian. And I worked for years and years in the Gulf area, for 7 years in Kuwait, 10 years in Oman. And now I am in Oman because it's a country, I say, that has given me so much well-being, has prepared me for coaching, actually. And I feel so much at ease, a country that is clean, people are quiet. They whisper, I say, they don't talk, they whisper. And I'm Mediterranean. So we express things with passion and enthusiasm, and we go crazy about things that I needed that cooling down. So, that's
great.
it.
It's a pleasure to
Fantastic.
meet you. Yeah, I'm an adjunct professor of marketing myself, so really pleasure to meet you.
Right, pleasure to
Lovely
meet you.
meeting
Glad to
you
have
too.
you with us. Hope you come back. And certainly we're, that's part of what we do as a community, is look for providers like experts like yourself in various areas to help engage with the communities that engage with us and that we look to serve.
Yeah,
And
I would love that.
there's one thing I'd like to address that Bernard mentioned. He mentioned it several times, and it's so important, this fear factor. And I believe that it's patient fear that keeps people from moving forward. Whether they think, I mean, like I grew up thinking I was stupid, and yet I did okay academically. I did really well academically, I have to say. I mean, if I was modest, I'd say okay. If I was being accurate, I'd say I did a great job. I got a PhD in high-level brain research that not many people could do. But I really grew up thinking I was stupid, and it kept me, it put me in the position of having to be like a patient who was afraid to go say something to the authoritarian, the doctor, right? And so that led me to help people, and this is one of the things I coach people on, is moving beyond the fear, like recognizing the automatic pattern inside their mind that generates the fear, and then once they recognize it, interrupting it like that. As soon as they do that, they're free of the fear, and then they can move forward with confidence and without the stress, because fear, as you said earlier and Tim said, fear is something that is related to stress. I mean, when you're stressed, you're because you're afraid, you're stressed. That affects the whole body, the whole being, actually. So anyway, it's really important for people to learn how to move beyond that fear, because Tim, you said sending them the messages through the mail every other day, whatever. That's not going to get anybody to move, unfortunately. You know, because they're stuck in that automatic pattern of fear. So
they are, but I think that's the challenge. So part of that is at some point there's got to be a trigger to someone. But I think this as a response to Bernard's question, how are you going to reach somebody who's sitting there in this particular neighborhood, doesn't want to get out of that neighborhood, doesn't look around for any resources? You know, that's tough. That's a challenge, and it's got to be that outreach. It's, you know, sometimes you got to do like you know, there were neighborhoods where, when I used to live in Chicago, but more from, but it's community activism, things of that nature, but also focused on wellness, where people would go out and knock on doors. So whether it's knocking on the doors or sending that message, you know, that's one of the ultimate problems, is how do you get people who aren't proactive, who are scared of being proactive, are scared of taking that step for themselves, get them to take that first step of accepting a hand that's reached out to help them, and to engage with them. And that's a tough challenge.
And Tim, this is where I think it all comes back to the medical field, but it is separate. This is life development, which in some way plays a large part to things such as the medical field, confidence. I think everything should boil down to comfortability, right? So I call it I call it the pathways to efficiency, which is the knowledge, which you all are talking about, which creates the confidence, but then it should all boil down and finish with the comfortability. And when you walk into a space comfortably, that's when you're able to take things in correctly. But back to the life development part, I think that's a component where things need to be focused on. I talked earlier about your life infrastructure, each one of you all. If I was to speak to all three of you all, Mike Hayes, you included, all four of you all, what you all will find is you all are extremely honest with yourselves. You all understand, you know, exactly what commitment looks like to a specific thing, and you all understand exactly what hard work is. But if I was to take those three questions and ask somebody else, what you'll find is people understand the word, the term, but they just don't understand what it means. They don't understand with effort what it means. And that affects all industries, medical industry, learning industry, business industries, how they are structured, how the belief they have in themselves, like you talked about, doctor. Like this is a huge industry, and it hampers, it takes away from the ability to be successful with some of the things that you all are trying to do. You can't leave that proactive side alone, is what I'm saying. And it is not right next to the medical field. It is its own field, but it links to the medical field. If someone were to include that and focus on that, and also have something on the medical field alongside it, what you'll see is the two things merge together, in my opinion. But without that, no matter what someone says or does, a certain crowd is just not entering to that program. A certain crowd is just not going to that doctor. They don't believe they have mental health issues. A certain crowd does not have the confidence to hear that bad news that they can particularly hear, or they'll hear it late, like I said, reactively when something has happened to them. It'll just always be that crowd. Who is going to jump in that space and actually truly devote time, energy, effort, and money into that proactive side? That's what I do on a day-to-day basis. But that's what I think, especially on the medical side or on the wellness side, that people have to do. What Tim is doing when it comes to stress is extremely important. Daily stress, you see what I'm saying, which is different than this chronic stress that one has in the end where they're thinking about suicide. We have daily stresses all the time.
Oh yeah.
How do you
sure.
deal with those things? You see, how do you deal with those things? And what you'll find
Well-
is there's a lot of avoidance going on with daily stress, which takes away from
Absolutely.
going to see the doctor, et cetera, et cetera.
Yeah.
Right.
Bernard, I think that like when Tim comes out with his program, Tim knows how to put together content that is designed for the everyday person, whoever they are. And I think and I'm sure when Tim comes out with that program, it's going to be really, really great for people to understand how to deal with their stresses. And the work that I do is directly related also to helping people interrupt the automatic stress reactions they have. I mean, once you interrupt an automatic pattern, you're free of it, right? So, and it can happen like that. So that the trick is, how do we train people in? And that's why I'm working on online programs that I can sell very inexpensively, that I'll be loading onto the e-learning platform, The Great Discovery, because if I can get a program out there that somebody can buy for $50, it teaches them exactly how to interrupt your automatic stress reactions, just simply that alone, that would be fantastic. That would be great.
I mean, there go that financial component I was talking about. No, I'm joking. But no,
Yeah,
thank
yeah.
you guys for what you all, thank you for what you all are doing. I really appreciate this. And these type of conversations are extremely, I just think what you all are doing well. And I'm glad you all call it wellness, because people need to understand that and kind of how it relates to everything, truthfully. So I appreciate you guys. Thank you.
Bernard, that was
Thank
a
you,
great
Doctor.
that was a great summary for our exit on the program. Thank
There
you
you
for
go.
saying that.
That's right. So
And,
that's
all-
what, that's
all
what,
of you-
yep, so that's what we'll be doing in our future meetings in this, not only in this series, but others, is helping people understand wellness and health and how to take the lead on it. And we'll start getting into more of those techniques and how to get proactive, how to shape your mind on it, and a number of other areas. So come back and join us again. Love to have
every
you with
week
us.
for 4
Yep.
week, every week for
Yep,
3 more weeks.
Every
Hey,
here
also,
every week, but if you can't wait until next Tuesday, please join us on the Facebook group WellWaveNOW Healthcare Disruptors. The link is in the
Yeah.
chat.
All right.
oh, did you put that link in the chat? Great. If you want to save the chat, if you don't know how to do that, if you go to the chat, click the chat button on the bottom of your screen, and then go to the usually pops up on the right side, and then there's 3 horizontal dots at the top. If you click on
Sometimes
those,
it's the top. Sorry, Dr.
Yeah,
Bob. Sometimes
some-
it's the top, like now. It's
Yeah,
at the
I
top
said-
of the screen.
Yep, sometimes it's top, sometimes it's bottom.
it's the top of the chat.
That's it, yeah.
Sorry, top
Yeah.
of the chat. Thank you
Sometimes
for that.
top, sometimes
So
bottom. Yeah.
click on those 3 dots and then it says save the chat, and you'll have it. So then you'll have all the information there.
All right.
Sure
Yep,
appreciate
so-
everyone coming today. It was great.
Absolutely.
Thank you,
Thank
guys.
you.
Thank you very
And
much.
Bob and Breck, it's always a pleasure and proud to be here with you. Take care.
Great to be
Thanks.
here with you too, Tim and Breck.
About me. Wasn't it a pleasure being with me?
Always, Mike, always.
That goes without saying.
I'm the guy who gets forgotten all the time.
Mike, you know what the problem is? The problem is that on our screens, we're really